Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with our friend and our EHR editor, Mike Uritz. Mike, how you doing, man?
Oh, pretty good, Kevin. How are you?
Doing well. Thanks for taking a few minutes. And before we got started today, I wanted you to kind of give a shout out to a couple of websites that you've really been working on kind of behind the scenes to help further this EHR mission that I know you're on right now.
Oh, thanks. I appreciate that. So one site is dentalsoftwareadvisor.com and the other is dentalsoftwarecompare.com. And I'm really excited. Dentalsoftwarecompare.com was just launched and helps compare various vendor features, which is really interesting.
So one of the reasons I wanted to have you on today is that this year, 2016, is really the last year that an individual, a group, or a practice can register to receive those federal technology subsidy payments. And we've talked that medical, entities for a while now have been receiving these payments, but the dental industry is still kind of lagging behind a little bit, maybe not as aware of the program as they should be. So what is the program about, and how can our viewers get the subsidy money that's out there?
Well, the program is really about, if you meet the criteria from the federal government, then what you can do is technically, by having a certified electronic health record and jumping through a few more hoops, you can actually get up to $63,750 per dentist. So if you're a group of, let's say, 5 dentists, that's quite a bit of money. You mentioned the medical world. I've been involved, as we've talked about, with this program from the beginning. In fact, I was on a few committees when we were trying to figure it out, and I work in the medical world. And out of the $30-some billion actually given out in the last 5 years, not a lot of it's gone to the dental industry. And I just think because there's not enough education in the dental industry about this program, and this is the last year that you can actually register. So that's why it's really important that folks realize there's this program out there.
And you mentioned that certified dental electronic health record as being a prerequisite to obtain the EHR incentive funds. So how can you find out which vendors have the certified technology?
Well, probably the best way is I have a list on my site, dentalsoftwarecompare.com. As we compare vendors, an area that I talk heavily about is certification and meaningful use. So by going to that, you can get information on which vendors are actually certified. That is one of the hoops, by the way, that you do need to jump through. You do have to have certified electronic health record technology to get your incentive money.
And you and I have talked in the past, and you've kind of told me about some horror stories where somebody came to you for some help to obtain these incentive funds, and then all of a sudden you've learned after doing some research that a previous employer had already gotten the money, and the dentist didn't even know that. That's shady. That's a little scary. But how could this happen with a federal or state program?
Well, technically, I've worked with a lot of groups, practices, and individuals, helping them get the money. And there's a step in the program where actually you have the option as a provider working for a group to assign the money to that group or practice. Okay, and that's fine. And a lot of providers choose to do that because the practice does have the technology. But what I found was a lot of times in the past, a lot of the groups or practices did not tell the dentist that they were actually getting the money for themselves. So, and unfortunately, there's been some shady consultants in the past that I think just got the money and didn't tell the dentists themselves that they were using their names, they were using their information. And from my understanding, it's not illegal. It's it's unethical, obviously, but it's really important to be aware if your group or practice is actually getting the money for themselves, because certainly you can assign it to them.
And you and I have talked, again, we do a lot of talking about this subject, it seems, but how that some folks are leaving money on the table and they're not really even aware that they've previously received their first year payments. So can you kind of explain to our viewers why folks are kind of shorting themselves when it comes to this full incentive payments that you talked about?
Well, what I found by working with a lot of practices and groups is that a lot of them are aware that there's this first year money, and let's say they hired a consulting firm to get them the money. What they don't realize is that there's another 5 years in the program. So the first year payment is $21,250 per dentist. But as I said, a lot of these folks aren't aware there's another 5 years, which is over $40,000 that sometimes are being left on the table. So it's important to be educated and understand that there's another 5 years in the program, even if you did get the first year money. So that's really important. But again, remember, if this is the last year that you can actually register for the program.
So I know that, you know, there's a lot of questions about EHR. There's a lot of questions about the incentive program. So where would you suggest that our viewers go to really kind of learn what this might mean to them and to their practice?
Well, actually, I put together a webinar, and I have links to the webinar on both dentalsoftwareadvisor.com and also Dental Software Compare, and there's a lot of information in the webinar. So really, to get some basic and detailed information, I would suggest folks go to those links, and then they can certainly ask me questions, email, call me. I'm happy to answer anything for these folks.
Sounds good. I know they can reach you through those websites. So always good to talk to you, and always good to have your expertise shared, my friend. Thank you so much.
Thanks, Kevin. Appreciate it.